Palliative care is a critically important part of quality of life for patients and families to help support what matters to them while they're working on getting better. We want to make sure that they are also feeling better. So it's typically a very person-centered and family-focused approach to care that helps address the distressing symptoms, pain, and side effects that can happen alongside a particular disease-directed treatment. And it's really considered sort of an extra layer of support that patients and families need to feel well while they're working to get well. I think palliative care is an important component of helping empower patients and their families bring the expertise that they have to the table about what matters to them. And that's a critical component of providing quality clinical care, because when patients and families can talk about what's important to them, that can help guide the treatment plan and the care plan and the supportive services necessary that make sure that what matters is front and center and sort of puts them at the heart of healthcare. One of the reasons that I think palliative care is a great example of a model or approach to person-centered care that can help us make our roadmap to consumer clarity a reality is it's a team-based approach to care that really focuses on all the different players that put patients and families at the center of the healthcare delivery universe and assesses what matters to them right up front to align the goals that people have with the treatments that we provide and the community-based services that they may need outside the four walls of the clinic to be sure that their daily lives, that they have the opportunity to live an experience of high quality in the things that matter to them alongside what they're dealing with in terms of their disease process. So it really brings that focus to the whole healthcare system. So our goal is to embed this person-centered care to every aspect of how patients experience their care. There are a number of skills that both patients and families need to sort of hone when they're thrust into this experience of serious illness. And the clinicians also need to have skills. And I think the sort of fundamental core of good quality person-centered care that we talk about in the roadmap is the communication skills that matter to align what people care about with the services that we provide in the healthcare setting. So communication isn't something that you think about as a specific learned skill, but we need to start thinking about it that way, both for patients and families to have the words to use to get the care that they need and want, and for clinicians to be able to sort of really focus on those priorities that patients and families have. That's a learned skill that takes training and practice, just like learning how to do surgery or other types of disease-directed care. We really need to focus on supporting patients and families to have the confidence to raise their quality of life concerns in every setting so that that can be part of the care that we deliver. And the clinicians need to be receptive to hearing that sort of expertise in that person-centered, family-focused way. That's a key goal for next steps.